welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Can heart medicine lead to depression? All patients who have had a heart attack are typically treated using beta blockers. According to a Swedish study conducted earlier this year, this drug is unlikely to be needed for those heart patients who have a normal pumping ability. Now, a sub-study at Uppsala University shows that there is also a risk that these patients will become depressed by the treatment. We found that beta blockers lead to slightly higher levels of depression symptoms in patients who had had a heart attack but were not suffering from heart failure. At the same time, beta blockers have no life-sustaining function for this group of patients, says Philip Leishner, a doctoral student in cardiac psychology and the study's first author. Switch from smoking to vaping to improve respiratory health, study finds. A new paper in nicotine and tobacco research published by Oxford University Press finds that people who switch from smoking cigarettes to vaping see improved respiratory health. But people who begin consuming electronic cigarettes while continuing to smoke regular cigarettes do not report improved respiratory symptoms. Vaping reduces exposure to toxic chemicals, but it has been unclear whether switching from cigarettes to e-cigarettes results in a reduction of the respiratory problems like wheezing and coughing, common in regular cigarette smokers. Researchers here use data from Population Assessment of Tobacco and Health study, a national longitudinal measure of tobacco use in the United States performed by the National Institutes of Health. The investigators here observed adult participants between 2013 and 2019 who reported smoking cigarettes exclusively at the beginning of the investigation and reported a baseline cough or wheeze. The researchers divided the subject into 4 groups. Those who transitioned from exclusive cigarette smoking to quitting nicotine altogether, those who switched from cigarette smoking to vaping exclusively, those who continued to smoke cigarettes only, and those who kept smoking and also began vaping. Researchers highlight the best time for RSV vaccine during pregnancy. Current guidelines recommend that pregnant people receive a vaccine against respiratory syncytial virus (RSV), which typically causes mild cold-like symptoms in most adults but can be deadly for the infants during weeks 32 to 36 of pregnancy. New research led by investigators at Mass General Brigham suggests that vaccination earlier in that time frame, closer to 32 weeks, could provide the best protection for newborn against RSV. The findings are published in the American Journal of Obstetrics and Gynecology. To assess whether maternal vaccination timing is an important consideration for RSV vaccination, the investigators measured RSV antibodies in the umbilical cord at the time of delivery among 1 to 4 women who received the RSV vaccine during weeks 32 to 36 of pregnancy and in the blood of 29 2-month-old infants of these women. All study participants were receiving care at Massachusetts General Hospital or Mount Sinai Health System in New York City. Levels of RSV antibodies can predict protection against RSV infection in infants too young to yet receive their own vaccines. Consistent bedtime sleep may lead to better child emotion. A study published in the Journal of Developmental and Behavioral Pediatrics showed that children who followed a consistent bedtime routine and fell asleep at the same time each night displayed better control of their emotions and behaviors when they were under stress or working with others. Researchers analyzed sleep and behavior data from 143 6-year-old children in the Penn State study. When children in the Longitudinal Insight study were newborns, their mothers received training in responsive parenting, which involves responding to a child's emotional and physical needs in a warm, timely, and consistent manner. The new analysis from the study demonstrates continued benefits of regular sleep timing. Children who had consistent bedtimes were generally able to regulate their behavior and emotions, says Dadzi, doctoral student in behavioral health. On the other hand, children whose bedtime and sleep times were all over the place showed more impulsivity and less control. Children in the study wore a monitor on their wrist for 7 days to measure their nighttime sleep and activity. The devices monitored multiple aspects of sleep, like time the child fell asleep, time the child woke in the morning, the midpoint of sleep timing, how efficiently the child remained asleep, and the total amount of sleep the child got each night. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.